Welcome to the BioBalance Healthcast, episode 693. Case study, Hormone Misinformation.
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. I'm Dr. Kathy Maupin. Yesterday, I had a patient who was one of my patients from a long time ago. I had to reopen her old chart when she came back. But she told me a story, this is like a case history, of what she's gone through since she left my practice 2 years ago in 2023. And she came to me for estrogen and testosterone replacement more than 5 years before that. And she was a patient that I had to individualize her care because she has some different genetic imbalances that I had to work with so that I could get her what she needed. So knowing that she's not just easy, some people, the dose doesn't matter. I mean, some people are just easy to treat because they have take the average amount of hormone. They don't convert it into anything. They don't have side effects. They're easy. Not always. In fact, that's the minority of my patients. But she told me a story about going to doctors in her area, not even her town. She went throughout the state to different doctors who said they were hormone specialists. She went to an endocrinologist. Endocrinologists are supposed to know everything about hormones, but here's the secret. They don't know anything about estrogen and testosterone in general, unless they have some unusual reason to know about it or to learn about it. They learn about every other hormone, but they have taken estrogen and testosterone and progesterone and passed that to the gynecologist. So, in 2002, when the WHI study came out and was misinterpreted, every OBGYN I know but me stopped their patients' estrogen. And that is not because I'm careless, it's because I read the study. And the study really meant not what it said in the title, not what it said in the abstract. It proved that if you add Provera to estrogen, you increase breast cancer risk and you increase heart attack risk. But if you just give estradiol and normal progesterone, which they didn't even try, they just gave estradiol, your risk of heart attack and breast cancer is less than somebody who takes no hormones. So I didn't stop my patients' estrogen unless they wanted to. Most of them couldn't tolerate it. They felt good on their estrogen. But it was in 2002 when I started BioBalance. And that's when I was trained by a doctor from California how to treat patients with pellets. My pellets are pure testosterone, pure estradiol, put under the skin in your hip, and they dissolve over the period of 4 months. So for 4 months, you have your hormones back from what you just like you used to have when you were young. It makes you feel like you're normal again. And it makes everything else, your metabolism, everything else run better because aging decreases our metabolism and decreases everything. And we end up growth hormone, everything else. Testosterone and estrogen help that and bring it back. In fact, it even brings back your ability to think. So my patient had left me only because she got tired of flying back from her state to me. And it wasn't about not being happy. She figured that she could find somebody in her state that could teach her. She went to the endocrinologist, and he goes, I don't think women should have testosterone. However, in his journal, Endocrine and Metabolism, there have been lots of different studies and articles about how women need testosterone to keep their bones healthy and their brains healthy. So she didn't take his treatment. She went to a couple other doctors who are in a franchise. Franchise is, somebody starts an office and then tries to replicate it all over the country. And they hire doctors to come in and do what they're supposed to do, I guess. But they don't have any interest in the company. It's just a job. And she found that those pellets cause all kinds of side effects. It caused her hair to fall out. It caused her to have a lower voice. It caused her to have tons of facial hair. It had the side effects that my pellets didn't have, and she wanted to know why when she came to see me. So I'll digress from her pathway here for a second. We use pure testosterone powder pellets. There's only one additive in it to hold it together so that it will dissolve over time and over 4 months. So we use two specific pharmacies that make pure testosterone pellets. They're not cheap. However, there is a second class type of pellet which the franchises tend to use because they can make more money. They are very inexpensive and they're called micronized. Micronized testosterone has the side effects of what testosterone cypionate shots have. They just keep circulating and making DHT, and that causes hair loss, facial hair growth, severe facial hair and body hair growth. They also lower the pitch of the voice, and those pellets are not what I use. But the problem is, she knew that wasn't the right pellets. Everybody else in that office that was seeing these doctors looking for testosterone actually weren't getting pure testosterone. They were getting testosterone micronized that would give them side effects, but they don't know any difference. My fear is that people will get those pellets and they won't work, or they'll have so many side effects that they won't ever try another pellet again. So you actually have to ask the doctor about whether it's micronized or powder that makes their pellets. Most of the people in the franchises don't know. And they don't know that there's a difference. So she went to another endocrinologist who basically told her she shouldn't take hormones at all, which she wasn't high risk for hormones. And they had changed her life. So she ended up getting a pellet from one of the franchises, about a third of the dose of what she needed. And she has a unusual situation where she genetically converts a lot of testosterone into estrone and estradiol. So part of her pellet would become an estrogen, which would then compete with testosterone in terms of how it made you feel. So she asked about that. She knew the pellet that I gave her, one of the 3 pellets I gave her, had Arimidex or anastrozole, same thing. It's an aromatase inhibitor, and it has very few side effects if given non-orally. If you give it orally, like we do for breast cancer, it has all kinds of side effects, the worst being arthritis. But when we give it to somebody who has estrogen and testosterone, it stops that flow from the testosterone into making more estrogen. So estrogen can actually counteract the effectiveness of the testosterone, so people don't feel much better. I knew this about the patient. I knew what she needed. When she came back, I went over her old chart, and she goes, "Yeah, that's what I wanted." And they told me they never use Arimidex. I believe that it's because they read the insert on Arimidex. All the studies that were done on Arimidex had to do with breast cancer and breast cancer patients who have an estrogen receptor. So those patients are taken off estrogen. They're usually menopausal. If they're not, they have their ovaries out. Their whole metabolism is estrogen free. So then when you give somebody something that counteracts this testosterone to estrogen conversion, then they have no estrogen, and they feel terrible. Hot flashes day and night. And I think the arthritis is the worst thing that they complain of. They have a lot of swelling as well, just like too much oral estrogen would give you. So she asked each one of the doctors, they went into a rant about Arimidex, but I don't think they've ever used it, so they don't know how well it works when it's in a pellet, and it keeps testosterone in the dose of estrogen I give her estrogen, so that she doesn't get less testosterone and too much estrogen. So that was one of her problems. So as you see, doctors don't always know about hormones and women, and they don't always know about how to prevent women from bleeding or what they should do if they do bleed when they're on pellets. That is one of the biggest side effects, but my patient had had a hysterectomy, so we didn't have to worry about that part. But after she had gone to a practice that was a family medicine doctor who he did everything else, and just on the side he did pellets. Well, he didn't know anything about pellets. He didn't really even know when to draw blood, what levels were good. He didn't know what the side effects were. And so she said, forget it, I'm not getting my pellets from you. So she flew back and saw me. And we got her back on her regimen. This is really to tell you that everything a doctor tells you is not necessarily true. If they trained in residency in the last 20 years, up to 2025, that's basically everybody who's practicing right now, they have no training in hormones, none. So the endocrinologists don't do female hormones, and the OBGYNs were not trained. So they don't have, and there's nothing in their journal about hormones. So that's the only thing they read, because in general, OBGYNs, just like me, were so exhausted from no sleep, seeing people in the office working 36 hours in a row, that after we got out of residency, we had no time to actually relearn things and learn what the newest stuff is. But luckily, because I'm not up at night anymore, I have plenty of time to read all these different journals and see what they're teaching their specialists. And I take the best of whatever information I have and put that into my practice and adjust how I work with my patients. Yesterday, my patient was so happy that she had finally gotten her pellets, and she would, within a few days, feel better again. That she said, I am never doing that again, and why can't you have an office in my state? Well, I can't, because I only have a Missouri license. I guess my daughter could. So in the future, that could be, but not in the near future. I don't know if you know this, but doctors are usually licensed by the state they're in. To go to another state, you have to take another test or go through a vetting process where they choose you or they don't choose you. If they don't need an OBGYN, then they don't choose you. Basically, it's on that basis. Do they need that specialty? So I am not trying to talk down doctors. I'm giving them an excuse. They're tired. They work for HMOs. They're working for insurance companies by trying to do what they did in half an hour and 5 minutes. And that's not easy. But you should not have to take their advice if you know their advice is wrong for you. And you have to know the truth so that you can know when they're giving you bad advice. I've had another doctor send people away from my practice because he would test people's testosterone in the first 2 weeks after I gave them pellets. Well, there's a surge in your free testosterone level for about a month after you get them, and then it evens out for the following 3 months. So, and he was checking the peak, but not where people usually are for most of the time after the pellets. So once I told him that, I think he understood that, but see, he didn't know enough to actually know how to interpret their lab values because he didn't know what should happen with pellets. He had such little information that he didn't know what he was looking for or what numbers he should be looking for because they're different than what's on the lab sheet. So please don't think that if you've had one pellet from a franchise operation or even a private doctor's office that they aren't working for you, because they very likely could work for you if you had non-micronized testosterone pellets And if you have treatment, if you convert your testosterone into estrogen, they'll only know that after you've had your pellets, and they see that the estrogen's too high for what they gave you, or if they didn't even give you estrogen. They see the testosterone's too low at 3 months, and the estrogen is too high at 3 months. So when they check your blood work, they should be able to figure that out if they know about it. So this is an orphan science. I've been doing it for 22 and a half years. And so it's not really an orphan to me, but this is really all I've been doing. And that's what you need. You need somebody who specializes in this. I don't have a diploma that says I specialize in this. I have 22 years of reading everything and learning from my patients and also treating patients successfully. That's what you need. That's what you need to find out. And you always ask them, are your pellets micronized or not micronized? And you want not micronized. Thank you for listening. I hope that helps you choose a good doctor.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/BioBalance Health.